Good morning, good afternoon, good evening. I am Dr. Unati, the host of Dr. M Health Corner. Welcome to Dr. M Health Corner talk show. Today I'm bringing a beautiful topic. It's one of my favorite topics that I always talk about freely with my community of women, either in the workplace, in the society we live in. And interestingly, today it's actually a Vaginal Appreciation Day. Today, our topic is about painful sex and solutions. So I'm so happy I have an expert for you. Don't worry, we're gonna unpack all of it. Today, I have one of my favorite people. She's like a mentor. I watch what she does in the community. She's just amazing. I have Dr. Tope Fagita.
Thank
She is a CEO of a company here, and she is a lecturer at the University of Calgary. She is a family physician, specialist family medicine, and of course, she does all sorts of other things outside her clinical practice. Welcome, Doc.
thank you so much, Dr. Nati, for having me. I'm so excited to be on your show to discuss this very pressing topic. I'm so glad we both have the balls to come up and talk about it, isn't it?
I
It's our
know.
day-to-day bread and butter, so it will be really nice to get the audience to join us on this very interesting topic. Thank you.
Thank you so much, Doc. I can see people are coming on live. Thank you so much to our viewers. So, you know what, Doc, tell me, what is painful sex? I look at sex, globally, in the sense of it's not just the localized area, painful, right down there. It starts in your brain. Really, I would like us
Right.
to unpack that and just basically for people to leave this place knowing that it's not just maybe in their brain. Sometimes some people say, oh, and it's not, it's in your mind, it's in your brain.
Mhm.
And
Mhm.
sometimes it could be local. Do you want us to unpack what is it about exactly?
Awesome. Thank you so much for that. I think we can only appreciate what painful sex is if we know what good sex is. You understand, as couples in relationships of one for one kind of the or the other, sex, I believe, is part of good health. The World Health Organization doesn't define being healthy as the absence of disease, but just as we talk about physical health, we talk about psychological health, we talk about our emotional health, sexual health is so important and is a part of that big thing called good health. So good health, good sex is part of good health. Now let's
I love
unpack
it.
what Thank you. Let's unpack what painful sex is. So that means if the sexual experience doesn't give you pleasure, and that pleasure, I love the way you talked about sometimes starts from the brain. And yesterday I was coining up a new word. I called it mental painful sex. Now, it's not always physical. Sometimes it's
Yes.
psychological. We're going to dig deeper into that. But yes, when the sex becomes uncomfortable, when it becomes unpleasing, when it's like you're not interested, it doesn't make you feel good, you can't be aroused. So it's more than just the physical act of intercourse, it's everything else that's around it. So when that's not fixed, that's part of what I would define as painful sex. Thank
I
you.
love it. Thank you so much, Doc. So let's
Yeah.
dive on it. What are the causes? Like you were mentioning, it's brain and then it's localized. Do you want to delve into that? What are the causes of painful sex? Because I'm pretty
Thank
sure women here, even their spouses, are coming here to watch us to
That's
understand their women better.
absolutely. So causes of painful sex, I think most, especially for us women, when we talk about painful sex, we just look at our private organs, our private parts. So sometimes that definitely can be a cause of painful sex. So we look at gynecological issues, problems with the skin around the private area, problems with the vagina itself, problems with achieving an orgasm, all of that. So we have the gynecological causes of painful sex. Talk about conditions like endometriosis, which is a condition where the cells lining the uterus find themselves in so many other areas of the pelvis where they shouldn't be. And that can also be a cause of painful sex. We talk about infections, whether these are sexually transmitted, whether it's an overgrowth of the normal bugs that we should have in a vagina, like bacterial vaginosis, and like Candida, for example, if there's an overgrowth. So we talk about infections. Some people, if they've had an episiotomy or if they've had pelvic surgery, they could physically have pain. But that is one part. The other cause, of course, is the psychological, which I feel most of us tend to abandon or put on the back burner. So we talk about problems with desire. We talk about people not even being interested in having sex. This could be secondary to some mental health issues. For example, depression and anxiety. That can make you not want to have sex. You can be on some medication that just makes you not feel like having sex. We look at body image distortions or disorder. You were probably a size 0 when you met your partner, and now you're a size 18, you're a size 20. You don't know what, you're even ashamed to take your clothes off in front of your partner. You know, all of those can also lead to a painful sexual experience in total. So it's not just about the act, it's not just about the disease, it's also the psychology underneath that could cause painful sexual experience. I'll stop there.
You know what? I loved it when you mentioned the psychological part. We see this, Dr. T, in our clinics. I mean, how many times we see women telling us that I've been married for 20 years, or even younger women. I've seen younger women in their mid-30s, or, you know, there's that age range that sometimes we forget about, the mid-30s to mid-45, where women are undergoing all these hormonal changes. And honestly, I've seen women in that age range, and they have not had sexual intercourse for 6 months to a year because of that body image consciousness. Yes. So tell me, in all that, I'm pretty sure there's solutions. And of course, do you want to probably tell us more about how do people move forward when they want to solve that? Because at the end of the day, this definitely affects relationships. We can't deny that.
Absolutely. And I just think one thing before I get to that lovely question, Dr. Nati, about a few solutions, is to know that painful sex or painful sexual experience is not always about the woman. It takes two to tango. And here I'm talking about opposite sex relationships. You know, so if you're in an opposite sex relationship and your partner, the male partner, I know that's your passion, Dr. Nati, starts
of course.
You know, when they start to struggle with erectile dysfunction, when they can't get it up, when they can't keep it up, when they don't even have any interest because of hormone changes. So hormone changes is not just about us women. Men too could have low testosterone, which would affect their libido. Men could have underlying medical problems like diabetes mellitus. Men could have high blood pressure. They could be on diuretics. Certain diuretics can affect their erectile function. So please, ladies, don't shy away from it. If you feel your partner is struggling in one way or the other, you know, it takes two to tango. It's not just about you. The man too may be struggling psychologically with his libido. He may be struggling because he's got a bit of erectile dysfunction. So please, let's be aware that it's not just about us. It's about the other partner. So now let me go to your question. We're talking.
I loved it.
Thank you.
And more especially with this COVID, in the pandemic, people have lost jobs, Dr. T, people are going through stuff, like there's lots of depression, there's lots of anxiety. I'm glad you're mentioning the male component, because I'm starting to see even younger people in their early 40s, they're struggling, of course, with erectile dysfunction. So thanks for mentioning that. Of course, yeah, go ahead.
Thank you. So talking about the solutions, of course, the solution would be dependent on the underlying cause. So once we're aware that it's not always a physical cause, it could also be psychological, it could be medication linked, it could be secondary to other comorbidities. So it could be secondary to other medical problems that a patient may be dealing with. And top on this list will be diabetes, hypertension. So if as a diabetic, you're finding out that, you know, you're no longer interested in sex, you don't find the sexual experience good, it's time to talk to your doctor. It's time for us to explore why there is a problem. And once we're able to identify why, then definitely we can go into the solutions. If you find it's more of a mood thing, like you're just not interested, it might be time to talk to a therapist There are psychologists out there that could help you. Another thing, especially for women from our subcontinent, a few of us, and that includes me, have been exposed to some form of abuse or the other as children. And oftentimes we carry this over to adulthood. So whether you were sexually abused as a child, whether you had a female genital mutilation, whatever that childhood experience is for you, it might be impacting your social life. It might be impacting your relationship. It might be impacting your health. Remember, sexual health is part of your overall health. So if you're failing there, it might be time to look back and deal with some of this unresolved childhood trauma. And that might actually be the solution for you. That might actually bring the joy back into your relationship. That might actually make you healthier. So you might be a fit, six-pack, everything, but you just got this trauma you're dealing with. It's time to speak up. There's nothing to be ashamed of. Let's talk about it. Let's help you to have good
I loved it. Dr. T, I loved it. Your statements are so packed. I loved it when you touched on the childhood trauma. You know, recently I was listening to a speaker on Clubhouse, and this lady is a psychologist herself. She's helping people out in the world. This is a person who holds a beautiful position in the society, helping people, but herself personally, she's struggling with childhood trauma. She had issues in the past, and even the way her parents, let me rather talk about her mom. She said her mother, when she addressed issues of sexual education, if there was any, anyways, she's from the African continent, and she said it was demonized. Sex discussion was demonized. So I find it plays a big role too in the way how women are showing up in their relationships with their spouses or their partners, because of the blockage that occurs in their mind, because of how even parents talked about sex. So how do you, now we are watched by women from all ages here. So tell us, how can they start a discussion around sex? Because it does play a role.
Absolutely. So sex education is really important. And it's good that we stay in a part of the world where it's part of the curriculum. So
Yes.
usually for children, a good way to bring up the discussion is when you get an email from their school or a letter from their school stating, hey, we're going to be discussing sex education. Or maybe they've had the lecture, because usually you need to have parental consent. It might be nice to just have that discussion as a follow-up to what the child has learned at school. And then you can start to open up and let it be child-led and just help your child to have discussions around this. I mean, I was recently in a meeting. This is actually in the UK. I know the legal age here is, I think it's over 15. And there are 13-year-olds exploring sex. There are 13-year-olds being treated for sexually transmitted infections. So especially for us from the from African subcontinent, we should not shy away from it. We need to talk to our children. We need to educate them. Our parents, when I was growing up, it was, like you said, Dr. Unati, a lot of stigma around even
Lots of
talking
stigma
about sex.
around it. Yes.
Yeah, my mom would say,
A lot of us never had a formal education, Dr. T. There was never. A lot of children explored it outside, and that's why we had a lot of teenage pregnancies. Actually, as a matter of fact, I thought teenage pregnancy, well, I'll talk about this side of the world, in the Western side, it's not as high as it was before because of this education that people are doing even in schools. I like that. Go ahead, sis.
Thank you so much. So yes, we should talk to our children, use the school curriculum, look at what they're doing. We should be conscious of what our kids are doing. These days, information is available at the tip of every child's fingers. So what websites are your children browsing? What programs are they watching? How observant are you? How present are you in your child's life? I believe as parents, we should not just look away. We should be more present in what our kids are doing. Sometimes we need to play some detective work, and just see and instead of being punitive, sit down and find out why they're doing what they're doing. And you'll be so amazed at what children will tell you. You need to really tell them about pedophiles. You really need to educate them that it's not always black and white, especially these days of the internet and the World Wide Web. It's not always black and white. I believe parents should be very present in the lives of their children, in the lives of their teenagers, and not just fold their arms and think everything is going to be hunky-dory.
I loved it. And also the naming and using the real names for organs. Growing up, we know that the vagina was not named by its name. The penis was not named by its name. And unfortunately, the pedophiles, they thrive with that. They thrive because you are calling, you have all these names. And I know that some parents, they prefer to use a certain code. That's okay, but it shouldn't be further away from the real name, right? I loved it, Dr. T. So tell me, now a woman comes with painful sex, where do we start? Like, I mean, you talked about looking at the causes. What are the solutions out there?
Right. So it really depends on the underlying cause. So let's start with the easiest or the more common ones. We find a few women douche. I mean, I've put it on my platform where I said the vagina is a self-cleaning organ. You don't need to use any special chemicals. Sometimes these chemicals cause a lot of irritation. And when there's the irritation, having sex or sexual intercourse can become painful because of the excoriations, because of the skin integrity that has been affected by all of these chemicals. So women, please stay away from douching. You don't need to douche. The vagina is self-cleaning. We've talked about infections. Candida is a very common one, and there's treatment over the counter. But just as a heads up, even though there's treatment over the counter, if you're treating your Candida twice, 3 times, 4 times, it's time to talk to the doctor. It might just not be Candida. And let me talk about the older woman, because I think, again, I'm sorry I keep going back to the African subcontinent. The older women don't want to talk about sex. They don't want to talk about vaginal pain. They don't want to talk about discomfort. They feel their kids should be the ones having sex, not them. And the guy is there, he's suffering. And then what happens?
Mm-hmm.
They start to cheat. They start to get a side chick. So please, older women, atrophic vaginitis or the hormone changes that occurs makes our vaginal lining thinner, makes us drier, makes the sexual experience more painful. And of course, what we do is to avoid it. Avoidance is not the solution. You should be talking to your doctor. There are good lubricants that you can use. There is a place for hormone replacement if that's going to be a suitable option for you. So these changes, you're not the odd one out. It is very common, and it's high time women stop being shy about it. As a physician, I normally would ask my women when they come for their physicals, if they want to talk about it, to just see what the sexual experience is like. So it's really important not to be ashamed to bring it up to your doctor. Like Dr. Unati says, we see this every day.
We do. And you know what? I like that. And I'm glad that we actually have colleagues that watch us here. I always encourage colleagues during that time, the yearly time when they come for their annual exam, talk about it, start that conversation, because there's also the cultural component, Dr. T, right? So unfortunately, even with men, I start these conversations, and honestly, a lot of times when they come in, it's actually the main cause, it's the main reason they came to see us. So it's always important for us to start these conversations. And of course, you mentioned that there's looking at the solutions. I would like you to specifically talk about that menopause part, because women, they think that's it. Now they've reached menopause, they cannot enjoy sexual intercourse. You want to talk more about that, what they can do?
Absolutely.
Because yes, it's good. Sex is good for their well-being, their liveliness, right?
Really? Sex is part of their overall health. There's no end date to sex. I was watching a TV program a few years ago where they were talking to a 100-year-old or 99-year-old couple. They were in their mid-late 90s. And they were asking the guy, what's the secret? And he said, regular sex.
Yes, good for them.
Sex. He did mention that as one of the pluses for the longevity and the joy that they've had in their relationship. So during the menopause, the woman's body undergoes a lot of changes, mainly because the level of the female hormone, the estrogen, starts to decline. And because it declines, we start to get a lot of symptoms. Let's start with the mood symptoms. You can imagine when you haven't slept, you've had hot flashes, your covers are on and off and on and off and on and off all through the night. You wake up
I
in the
know.
morning and a man wants to ask you for sex. That's the last thing you want to think about. So
Exactly.
it's not just about the vaginal dryness. It's about the mental and psychological impact of the menopause changes or even the perimenopause changes. Let's look at something. Menopause is a retrospective diagnosis. So we only talk about menopause 12 months after you haven't had a period. Or we could do a blood work if you've had a hysterectomy and, or if you've had medication that has artificially induced your menopause. So there is another time called the perimenopause, which is the time leading up to the menopause. And we find that women, apart from having more irregular, unpredictable periods, can start to have changes down below in the vagina that could make sex less pleasurable. They may start to have the hot flushes. They may start to have the anxiety, feeling on edge, unhappy. The mental causes of painful sex, that's what you have there. So don't wait till your period disappears. If you start to experience any of this, talk to your doctor. There is a solution. There are solutions. There's a lot that we can do for you. Don't go on Amazon buying stuff. Talk to
Oh,
us.
I know that. Thank you so much, Doc. I actually recently got to know about even laser for women who can afford it because of the menopause dryness. Women are seeing their private gynecologists, they are doing laser treatments. It's just beautiful, right? It's good.
Absolutely.
So, women out there, just know there's hope. Right?
Yeah.
Wow, Dr. T, we're gonna finalize here soon. So tell me, what's more can we do for this? Like you mentioned, the treating the depression if people are depressed. Anything more we can do for women? And of course, I would like
So,
a word for their partners too. I
absolutely.
love bringing in their partners, Dr. T. I'm pretty sure you do this too. I bring in partners
Absolutely.
to take it down and break it
Yeah.
down for people to understand. Yes.
Yeah. I think as women, especially with the partners, let's talk about it to our partners. Let's let our partners know if sex hurts. And if we have other ways, we can have sexual satisfaction without necessarily being sexual. What I
Yeah.
mean that you could have sensual, like a lovely massage, like non-penetrative intercourse, like there's so many other ways that you can get satisfaction. So definitely you should talk to your partner about it. You should let them know what satisfies you. You don't have to put up with the pain for how long. Women need to speak up. And men, if you're struggling as well, there's nothing to be ashamed of. Come and talk to us as doctors. Some of them are shy to talk to women. Let's be upfront. Choose to speak to
I
a male
know.
physician. Sometimes that helps. And when you book your appointment, don't tell them it's about your erection. Say you choose not to say. You don't know. Say it's a headache. And when you get into the room, let the doctor know exactly what it is. And
Exactly.
we'll definitely know how best to help you. So talking about it is very important. Looking for other ways to find sex satisfying is important. Relaxing, getting a massage, being rested does help. Using pain medication, because let's face it, some women with endometriosis may find penetrative sex very uncomfortable until their
Of course.
endometriosis is treated. So using a pain medication before sex is good. If you're sore around your vulva, using an ice pack after sex might give you some relief. So there's so many things that you can do to help
I
promote
love it.
sexual.
I'm gonna bring you back. I loved it. I loved it. And you know what? I love the fact that you are getting to even those non-penetrative ways because a lot of times people they think that game is over. So I
Yeah,
loved that fact that there's other ways to satisfy yourself and the partner. And actually, this day I was looking at it because it was the first time I got to know about this vaginal appreciation day. They were talking about orgasm, self
yeah,
pleasure. Because a
yeah.
lot of women, Dr. T, I'd like you to touch on that. Some women
Mm.
have never really had an authentic orgasm. They've learned to, okay, I'm going to fake it because I want him done. All right.
Oh, wow.
And so there's a lot of that, people, because
Yeah.
people they are very shy to talk about it openly. Do you want to talk about that psychosocial aspect so that people can communicate where do they want to be touched, and also the self-pleasure for women to understand that it starts with them doing
Yeah.
it themselves, so that you can educate your partner where you want to be touched.
Absolutely, and that's very important. It's all about the freedom, isn't it? It's all about
Yes.
having the freedom. If you're sharing your body with your partner, it's not about him having an ejaculation. It's about you also having an orgasm and having sexual satisfaction. So whatever that's going to take you, if you find your G spot, your very sensitive areas, talk to your partner about it. Doesn't mean you're a slut, because you
Yes.
also have to enjoy this experience. So don't say, oh, I'm too old for that, I shouldn't be talking about that. No, we should put all those cultural beliefs aside. And I need to bring this up here. A few women that have had female genital mutilation may actually struggle to
Yes.
achieve the orgasm, depending, because
Yes.
sometimes it's so terrible. They remove the labia, they remove the clitoris, they remove the most sensitive parts of a woman's body. So you need to start to explore your body to just find out. So for some people, it's just their nipples. You need to find out what is it that gives you that pleasure, and you need to be able to freely talk to your partner about it.
I loved it. Yes. So, women out there watching us, there's more ways to have satisfaction. Dr. T, we're going to wrap up, sis. Tell me, what are 3 gems women need to understand and take it home before we
Okay.
close here?
Thank you so much, Dr. Nati. I hope everybody has found one or two things to take away. But let me
You
tell
are
you about
amazing. I loved it. I'm bringing you back.
So the first thing definitely is that you can have satisfying sex without penetration. The second thing is that having painful sex doesn't always mean that you have a gynecological problem. There are other non-gynecological problems that could cause painful sex or can reduce your sexual satisfaction. The third thing is, don't be shy. Talk about it. We hear this every day. Talk to your partner, talk to your doctor, talk to a therapist. There's help available. And if you want to live long, sex is part of the game.
I loved it. Yes, viewers here, you heard Dr. T. Sex is part of the game. And honestly, it's truth. This is all biochemistry. We have happy hormones when we release, when you have sexual intercourse. Actually, there's studies, numerous studies out there that show people who have regular sex actually are happier, they have better relationships, they have their longevity. So are men. Recently, Dr. T, I recently got to know about men who ejaculate more have less risk of developing prostate cancer. I said, when I heard that, I said, that's not true. One of my clients was telling me that. And indeed, I went on studies. I checked. It is on studies. I pulled up Harvard study. So this is true, guys. There's endorphins, happy hormones. Sex is good as long as you do it with a person who is aligned with you. Right, Dr. T? A person who is aligned, because like you were saying, there's few things you threw out here that some people, they find judging themselves, thinking that they are sluts. And to be honest, this is between you and your partner. You have to be aligned with your partner so that you can have the greatest experience. I loved it. Dr. T, this was a beautiful conversation. I would love to bring you back. For some reason, StreamYard has been playing us here. I don't know. We keep getting frozen. I don't know why. There was a message at some point, but you were so clear, and I'm so grateful our viewers stayed right throughout. They are still watching us. Thank you so much to our viewers. As I said in the beginning, Dr. T is available, as you can see on our screen. Check out her website. She's got a lot of resources. She's even an author. She just wrote about her vulnerable story. I was so amazed when I checked out your forward. It's just beautiful. So you guys grab her copy. She's just right on there. Check out her website right on the screen and be in touch with her. Next week, we're going to come back here, same time, same place. We're going to bring all these healthcare thought leaders. They will be sharing us their expertise and the latest studies. Dr. T, I know that you have to go back to work. Thank you so much. You were awesome.
Thank you for having me. Thank you.
Thank you so much to our viewers too.